But first, I don't know whether it's because she's a known hard worker or just constantly connected to real Australians, but Pauline Hanson's constitutional challenge to the ongoing Queensland border closures is just what we need. It's also just what some dim-witted premiers need as well, which is a true test of their skewed medical opinion and their destructive stance on borders. Now, I refer primarily to Queensland's Anastasia Palaszczuk, South Australia's Steve Marshall, WA's Mark McGowan and the Territory's Michael Gunner. When you've got a federal panel of chief medical experts, most of whom are infectious disease specialists, calling on the opening of state borders, you'd think that these dimwits might treat that with the authority it deserves.
From a medical point of view, I can't see why the borders are still closed.
He is one of the most preeminent epidemiologists in this country, and it's not the first time he has said that. But as most of the country's state and territory leaders continue to ignore that advice, I think we've entered into one of the most self-destructive periods in this country's history. To borrow a Reaganism, as one editor did today, Premier Palaszczuk, tear down this wall. What's happening right now are bum-covering exercises by a group of self-obsessed state health bureaucrats. These people are absolutists. They're not aiming to flatten any curve. They've done that, and then some. But they're not satisfied with that. They obviously want to achieve a famous legacy, to be known as some kind of Herculean health officer who achieved perfection by reaching that nirvana of COVID-19 eradication. And in the process, each day, they are successfully eradicating more and more businesses, more jobs, more livelihoods, and eventually more lives. As the mental health experts have already indicated, the pandemic death toll won't be our worst toll of life from this period. Tourism Queensland estimates that the industry is now losing $1.5 billion every month those borders are closed. That is a massive $50 million per day, every single day.
Nothing has changed. We're reviewing it every month, but, you know, we're not going to be lectured to by a state that has the highest number of cases in Australia. And I hope they get their community transmission under control, because that means we will be able to open up sooner. So, you know, really should be asking those premiers questions.
Oh, stop. In terms of Sydney being the gateway to the rest of the country, I would probably match New South Wales's effort in this regard to just about every single country and city in the world. And you can see there, it's not about medical evidence anymore. It's not about health risk. It's not even about the economics. It's about Palaszczuk's efforts to save face. It's Queensland versus the rest. But what do you expect from a Premier who doesn't know that if you're carrying COVID-19 but are asymptomatic, you will test positive?
If you are sick, you must stay at home. If you have any symptoms, you must stay at home. I mean, how many times in the past have you thought to yourself, oh, look, it's only just a cold, I'll go to work, and then now we know how quickly flus and everything spread.
But
now
it's worse than that, Premier, because you can have asymptomatic cases. Isn't that the problem? Like, people can be taking all the precautions necessary without the testing. You're open to this sort of thing happening.
Well, like you said, the mandatory testing is not necessarily going to pick up if you're asymptomatic. So you can have a test and you still may be positive. But I think the issue here is a bit different.
Sorry, Premier, isn't that exactly what the testing would do? So if you're relying on people to come forward with symptoms, then sure, you're not going to pick up asymptomatic people. But if you're testing anyone who walks onto the facility, you will pick up asymptomatic people, and then you will stop it at source.
Yeah. Look, I'm happy to look into that.
As my teenage son would say, duh. And what do you expect from a Premier who backs easier access to parole one day, introduces legislation the very next, and then on day 3 cans the whole damn idea?
Will the government continue releasing prisoners early law that was introduced?
No, it's not a priority.
Why is that?
It's not a priority.
But why was it part of the bill then?
Sorry?
Why was it introduced as part of the bill?
Well, it's been misinterpreted, so it's not a priority. No, we've made the decision.
Who misinterpreted?
Yeah.
Sorry?
Who misinterpreted?
No, well, the department put it up as a proposal, and it sounded fair in the light of the COVID situation, but we've taken the decision not to go ahead with it.
It's like an episode of Yes, Prime Minister. Look, the daily tally of new cases of coronavirus, even in the state with the highest number of active cases, New South Wales, are the envy of the world. The risk of infection from opening borders now is infinitesimal. That is the statistical fact. Life is not perfect either, nor can we afford it to be. If these bureaucrats were consistent in their, oh, no risk, we can't have risk, we've got to have guarantees, well, they'd stop us all from driving cars. They'd stop us all from eating takeaway food. And meanwhile, in Victoria, similar story, they only have 90-odd active cases in a population of 6.4 million people. But Premier Dan has been incredibly slow to activate that dead economy, which is ridiculous. How's this? Victorians can't step foot into South Australia. Oh, no. South Australia has only been declared virus-free about 2 weeks ago. And I can see it now. Premier Marshall allows, finally, fellow South Australians to jump into the beach as long as you're all wearing full-body hazmat suits.